I would like to welcome Dr. Samina Zamindar to brief us about the WASH standards. She is a dynamic, visionary, and a professional ophthalmologist. She has, just a second.
You have to be a little loud, Sapna.
Yes, yes. Yeah. Just a second. Huh? Yeah. She runs a well-established ophthalmological practice in Bangalore with two NABH accredited eye care centers. She's a reputed name in implementation of quality standards in eye care organization and hospital infection control, ophthalmology practice, and surgeon. Many awards and accreditations. She's awarded the Young Quality Achiever at the 4th International Conference of Consortium of Accredited Healthcare Organizations at Chennai, April 18. She's a keynote speaker by Oman Ophthalmology Society for their Ophthalmology Conference 2018. She was invited as a faculty in Asian Ophthalmology Conference, Malaysia, to speak on phaco strategy for soft cataract, September 13. Trainer for phacoemulsification cataract surgery during surgical skill transfer, a course organized by All India Ophthalmological Society since 2015. She's a certified professional for quality implementation in healthcare organization, basic and advanced CPQIH course. She's a faculty for basic course of CPHIC, that certified program for hospital infection control. I welcome Dr. Samina Zamindar. Thank you, ma'am.
And also a young leader from the Leadership Development Program of All India Ophthalmic Society.
Thank you very much, Dr. Sapna, for that kind introduction. It's an honor to be a part of an Aditya Jyot webinar. Thank you, Professor Natarajan Sir, Dr. Jaideep, Dr. Sapna, for inviting me here. I would like to start by saying that there are many leaders who make more followers, but there are very few leaders who make more leaders. And Dr. Natarajan Sir is definitely one of them. So thank you, sir, for all your mentoring. Today, I'm very keen about sharing these 15 WASH standards, that is Workplace Assessment for Safety and Hygiene Standards from Quality Council of India, because I feel that there are more than 18,000 standalone eye care practices in India. And this is a great way, a wonderful and a very simple way in which they can benchmark their safety protocols. And this is going to help them sustain their practices and even obviously sustain the livelihoods of the staff who depend upon them. So I bring greetings from my staff in Bangalore. Friends, every day at work, we are at crossroads between what is the right thing to do and what is the easy thing to do. But I think you should take a minute over here to pat your backs. That if you've come so far in the pandemic, that means you have shown your commitment to safeguard your workplace. So congratulations for that. And this was the situation, I would like to share my COVID story, that this was the pre-COVID vibrancy at the hospital, different kind of trainings, our weekly meetings. And suddenly the COVID-19 pandemic changed everything. We had the Teachers' Day yesterday, and the pandemic itself is a great teacher. It taught us to live with grace amongst uncertainties. But this is what happened in the beginning. There was complacence. We all sulked. But slowly, just like what Sir Thomas Carlyle said, that our main business is not to see what lies dimly at a distance, but to do what lies clearly at hand. And we pulled up our socks. We decided to learn to live with the new facts. First and foremost, essential medical services cannot be postponed indefinitely. We will have to be there as eye care practitioners for our patients. Business continuity is important for all of us, and we had to find safe ways of doing it. Clarity and empathy became the most important pillars for sustaining practices. Training, motivating, and thus empowering healthcare workers to work without the fear of stigma of the disease and its consequences became our guiding principle. And we started doing what we always do the best: standard operating procedures, started making checklists, process maps, report all incidences, and reducing confusion while practice in the COVID pandemic, documentation of communication and communication of documentation. Why a standard operating procedure is important, and why is it specifically important during the pandemic? Because any new learning and training, what you share, which will happen in your organization without proper written down guidelines will be less effective. And the implementation of the same will be very, very doubtful. So of all times, the COVID pandemic is definitely the time where you should have written down standard operating procedures for the new protocols to be followed during the pandemic. We have achieved the WASH certification, and I truly believe that these are very simple 15 very well thought of standards which will allow us to benchmark our safety protocols with this program of Quality Council of India, and which will help us to sustain our practices. This is not difficult. Let me tell you very at the onset that people who have think that this is something which is going to be a lengthy process, it's not. Within 2 weeks, you will be able to achieve WASH certification, whether or not you have NABH accreditation. And is there a need? Now, the question for any certification or any such program, the question which all of us should ask is that, is there a need for such a program? We are already doing what we are doing. My friends, the post-virus business landscape will clearly include a large focus on health, safety, and hygiene conditions of employees, customers, and public at large. And this is the time to reassure everyone that our safety protocols are in place and give them a proper structure. So the clear goals of this certification program is to ensure safe operations and workplace for safety of employees, customers, patients, and public, complying with all new COVID-19 related requirements from the regulatory and health authorities, and ensure business continuity to serve customers, patients, and protect businesses. Why the word customer is used again and again as a clear goal for WASH? Because WASH is not only for healthcare organization. WASH is for any organization, any factory, manufacturing organization, educational institute. If they want to benchmark their safety protocols, they can go for WASH certification. And what is the intent of assessment? So the assessment itself is a very simple procedure. There are 32 agencies which are appointed by Quality Council of India across India, and you need to approach them. They will give you an application form. You need to fill a self-assessment toolkit and give it to them. And the assessor will either come to your doorstep or do an online assessment against the 15 standards, which are really very well thought of, which we are going to talk today, so that with the standards which will streamline all your safety protocols from A to Z for your organization to become a safe organization for all stakeholders. So these are, I'll start with the first, and I'm going to make this talk very short because I'll be very happy to take questions regarding this. So the first and the foremost is to demonstrate, the management needs to demonstrate its commitment to safeguard its workplace for employees, contractors, suppliers, customers, all stakeholders. So how do you do that? The first step is that however small your organization is, you need to have a COVID committee and a COVID coordinator. That's the first step. And you should be having a meeting agenda where you're meeting once in a week and reviewing each and everything related to the COVID which happens in your organization. Very important here is a communication protocol with all stakeholders in the form of circulars, posters, Zoom meetings, phone communication. Remember that the communication with your patients is going to become very difficult, and you should have streamlined ways in which how you will communicate with your patients. So many times only the patient is allowed inside your consultation room and the visitor is standing outside. So simple protocols like making a point that the doctor is connected to the relative or the visitor standing outside after each patient, and the visitor or the attender gets a chance to talk with the doctor will make a huge lot of a difference in your practice. The second standard for WASH is regulatory guidelines. The management, of course, must be aware of regulatory guidelines. And the important thing is that the entire resource of the updated document should be made available to all staff and all stakeholders by the COVID committee. Now, there are simple guidelines, like there is a new guideline which has come up, which clearly distinguishes between a primary contact, a high-risk primary contact, and a low-risk primary contact, and what are the quarantine requirements for a high-risk contact and a low-risk contact. And this is so important, and this has to be, it is going to be the responsibility of this focused group, the COVID committee in your organization, to keep aware, keep track of these new guidelines and give the salient information to all the staff members. The business continuity, which is important, is that suppose if you have an absenteeism of staff, what is your plan for that? If you have disruption of supplies, you don't get your intraocular lens, do you have adequate stock? If there are travel restrictions where your staff is not able to come, how are you going to allow for the travel passes? The risk management, the fourth standard, is that the organization needs to be aware of the risk arising of the COVID-19 crisis and have suitable risk mitigation measures in place for safe operations. So it starts by risk assessment, risk mitigation, and then the most important is risk readiness. In case if a worst case scenario happens, there should be enough clarity amongst your staff that what will happen. Otherwise, they will be living under the stigma, and a lot of hiding of their symptoms will happen. So what any organization need to do is that empower their staff with a concrete course of action based on knowledge gained from present guidelines for these four distinct conditions. First, what to do if either one or your staff or their family members develop COVID-like symptoms. Second, when is the time to get them tested, where to get them tested, and third, what to do if they test positive, and fourth and foremost, when can they safely resume work. So of course the guidelines are changing, but once in a month at least you should be able to release these guidelines, keep in direct communication with each and every of your staff, and see that this guideline goes to them and they're very clear that the entire team is going to be there with them in case if such a thing happens, and there is no stigma of the disease. They can openly disclose if any such thing happens. And that is the only way which we can see that the spread of the disease is shunned. Communication, like what I already said, that the organization needs to determine and establish processes to communicate. So there has to be a communication in between staff, between the staff and the doctors, between the management and the COVID committee and the staff, or even with the visitors, like what I said. At every level, there should be a written down protocol how the communication happens, especially if you're doing surgeries and you want to reduce the number of post-operative visits. There should be a way in which there is structured phone calls made to the patients after the surgery so that their number of visits, post-op visits, reduce. And this is going to be very, very important to reduce the risk of transmission. The sixth, of course, is to establish hygiene and safety guidelines, which I'm sure all of us are already doing. We are already taking due precautions. And Dr. Sapna gave us a wonderful talk about how we safeguard our practices and make our hygiene and safety protocols very stringent in these times. There are simple ways, like what I'm sharing you, this kind of audit mechanism. See, you can do surprise audit of the safety protocols for the staff and for the patients, so that every protocol is checked on one particular day, or any day. The hospital infection control nurse can decide when she wants to open up and do this hygiene. That is the way in which you decide that every single thing, what has been decided, is getting implemented. Preventive measures, of course, entrance control system, adequacy of PPE stock, separation and isolation. And the organization needs to make provisions for handling situations arising out of the possible COVID-19 infections to prevent the spread of infection. These are all preventive measures. I'll share some of the photographs, what we are doing in our organization in Bangalore. There is, you can see the sterilium, there is a screening desk. I'm sure everybody is doing that. Personal protective equipment. There are scrubs for all staff and doctors. All staff and doctors come and first change into scrubs. And there are masks, 3M half-face respirators for doctors and surgeons, N95 for optometrists and OT team, 9504 for the staff, face shields, plain eye goggles, rubber gloves and plastic aprons for housekeeping staff along with that. Social distancing, the organization needs to make provisions for social distancing at all levels. So for this, for example, we made this extra shade outside our hospital and see that all patients and visitors are first seated comfortably outside and called inside only when their turn comes. Even inside, the seating arrangement has been completely changed and the chairs are numbered. So they use the same chair in between their optometrist and the ophthalmologist chamber visit also. There are new barriers. I'm not sure whether you're able to see the barrier, but there are barriers made around across every possible counter in the hospital. Breath shields for every equipment, not just for the slit lamp. So training and awareness is very, very important. Like, for example, in the April lockdown, we had about 14 Zoom sessions with all our staff and doctors. The training on subject matter, protocols, awareness about the disease spread, guidelines on quarantine, and meetings and brainstorming and SOP was done even before we again started practice. And I would like to quote Dr. Atul Gawande over here. Dr. Atul Gawande, who gave us a wonderful surgical safety checklist for all of our surgeries, also was a pioneer when the pandemic started. Right at the beginning of the pandemic, he said that the approach for safety in a pandemic is like a drug cocktail. All the elements, hygiene, screening, distancing, and mask, everything has to work together. And if you skip one, then the treatment will not work. But when taken together, taken seriously, they shut down the virus. If you remember Dr. Shashank talking to us in the morning today, that the common likelihood of transmission is when you relax and when you open your mask and you're sitting and eating your lunch or coffee together. That is not possible. And that has to be trained again and again and again to your housekeeping staff, to your all staff. We have to remember that we can be safe and everybody can be safe if everybody around us is safe. So these are the common areas where transmission can occur, and canteen, doffing, donning, these are very, very particular. We should be very particular to see that the safety measures over here are at most. Waste management, all the waste which is generated over here, most of us have proper waste management systems in healthcare organizations, and we are following that. But mask found lying here and there is still a problem, and we need to work on that. Ventilation, extra exhaust fans kept wherever possible. Definitely in toilets and in smaller rooms, but even wherever in a consultation room also, exhaust fans are, extra ones are put up, the fans are already on. And fortunately, the operation theaters which have air handling unit and HEPA filters, because of the fresh air exchanges and the air risers, the transmission risk is really very less. So public interaction is the 11th and a very important standard of WASH, that we need to have safe public interaction. Telemedicine, most of us are using telemedicine as a backup support. All our follow-up appointments are given through telemedicine, and it is about time that each one of us start working on telemedicine. Fortunately, Karnataka Ophthalmic Society, under the leadership of Dr. Raj Shekhar, has given us a very good telemedicine tool, and we are all using it. These are different kind of simple animation posters put up in our waiting area, that we still care for you. And this is what they need to do. So it is loud and clear for the patients that all 4 measures taken together is going to be very, very important. Safety at all times, every time. The 12 standard apply chain, this is mainly applicable for businesses which have factories and manufacturing units, but even for us, if there are any vendors or supplies, we need to see that the do's and the don'ts pertaining to entry into the organization are very clear to them. Transport mechanism, in case if your organization is responsible for transport of your staff, then the clarity about how they will go, or if you've started some outreach activities, then how you're going to make it safe is going to be the management's responsibility. And documentation. The beauty of the WASH certification is that they do not stress much on documentation. It is more on implementation. Only the basic mandatory documentation is required. And we were very happy that as soon as the pandemic started, like I said, we had so many Zoom meetings with all our staff, and all our doctors and staff together put in this kind of standard operating procedures in detail For at every level, there is an SOP available. I'll be very happy to share that with everybody. And you can just write to me at zamindaricenter@gmail.com, and we are going to share that with you. So this SOP was well appreciated, and we had shared with all societies. And we keep updating this SOP. We've also made a risk readiness SOP, and we'll be happy to share. The last and the most important standard of WASH is control of discriminatory practices. There should not be any discrimination with patients, with staff of any category regarding giving them PPE or any other such things, or even when they recover from COVID and come back, there should not be any stigma. This is a lovely poster by the government of India standing together against COVID-19 stigma. First, discrimination due to fear and misinformation, empowering people with health literacy to counter prejudices and discrimination. Anyone can be infected, but most people recover. So this knowledge has to be reiterated again and again, and targeting those rendering selfless service, us doctors, will only weaken our fight against COVID-19. So it is our responsibility also to keep educating public at large about what is given here by the government of India. Friends, psychological disturbances due to multiple reasons during the pandemic amongst our staff and patients is going to cause some situations in your hospital time and again. And you will have to have the wisdom and the kind of a very thoughtful approach towards what has to be done. And meetings, communicating, reassuring them, and continuously being in touch with all your staff is going to take you out of this pandemic safely. It's very, very important. So remind, reassure, and help your patients relax. For example, we have put up something like this outside our hospital, that dear patrons of our hospital, please remember that behind these masks and face shields, we will always remain your caring and smiling team, Zamindar. We maintain social distancing, wear masks, and talk less for our common safety. No one is safe until everyone is safe. So stay safe. It is very, very important that we all reach out to our staff. And when we cannot hold hands anymore, we decide to hold hearts and move ahead. We've been doing this Eye for Quality teaching and training doctors from across India in our in-house conference hall. But because of the COVID pandemic, we opened up an online training program between July 7th and 17th, where Dr. Jaydeep and Dr. Sapna also were our very enthusiastic participants. And we had even participants from Bangladesh and Nepal. Our next course starts from 8th of September, and we welcome you to join us in this learning journey about WASH and entry-level NABH standards. Friends, during the downtime, increase your skills, improve, learn something new, and make your practices sound and sturdy to get back in full force once the pandemic is over. This too shall pass. The days and months of pandemic will stay vivid in our memory as a time of our life which allowed us the luxury to pause and reflect on life itself and what we want to make of it. This is my address and my email address, and please reach out to me regarding any COVID-related SOP. So thank you so much once again to Aditya Jyot Hospital and Professor Natarajan. I will be very happy to answer any questions about the WASH certification.
Thank you, Dr. Samina. That was a fantastic presentation, and really, so when we attended your 10-day course, it was really an eye-opener for us, and I'm sure we have learned a lot, and we are implementing whatever we can, and we are always eager to learn from you. And today also you gave us a few new insights, so I'm sure all of the people who are listening to us will implement these and make our workplace safe, and all the staff also can be reassured along with our patients, so that we can get back on track as soon as possible.